used in musculoskeletal system. So this is Malaysia. Malaysia we have seen earlier also, porosis and scopy. Scopy means visual examination. Okay, arthroscopy. This word is very important. Osteoporosis. Osteoporosis. If you ask to explain osteoporosis, the medical term, explain the medical term osteoporosis means, you'll have to write oste means bone, porosis means porous bone. So osteoporosis means porous bone. Finally, there are few more word roots are given. Limi may not be that important. Musculo, my. This is what I am saying. Milo and my and musculo. Don't get confused. One means mylo, muscles, and my both means muscles, but mylo means bone marrow. Fascia, fascia, and fascioplasty, a word fascioplasty, which means surgical repair of the fascia. Okay, what is fascia? Fascia is a thin layer of muscles which cover on top of your skeletal muscles. This is another layer of muscles which cover the top of your skeletal muscles. So these are, you'll have to study entire this thing. I have only looked at the tables for your musculoskeletal system. Okay. Um, but when you study, I suggest you to first study the musculoskeletal system because it's a large chapter and also very important chapter. Now let's look at the lecture number 2, body organization. Okay. In this lecture, levels of organization. Okay. Important, just basically understand it, that body is organized in different levels. These are some of our for your refreshing your memory of studies. Tissue, cell, and all not very important. Okay, so after tissue, cell, tissue, organ. Different systems you don't have to study because you know this already and not very important also. Okay, nervous system, what do you mean by nervous system? What do you mean by urinary system? It's all common sense, so it's not important. What is important is this part of the lecture. From here onwards, it is very important. Okay, different planes of the body. What do you mean by sagittal plane? What do you mean by frontal plane? Okay, and how each plane divides your body. For example, median plane or sagittal plane divides your body into right and left half. Frontal plane divides into anterior posterior. Transverse plane divides into upper and lower. Understand about four different body cavities, the large body cavities, dorsal cavity. Any of this can be asked. Where does your brain and spinal cord lies? Which in which cavity of the body? So you may be asked about thoracic, abdominal, pelvic, and dorsal. You'll have to write that dorsal cavity. This is also important. How the body is divided, different parts of the body, anterior, posterior, okay, inferior. What do you mean by inferior? What do you mean by superior? What do you mean by lateral? And what do you mean by medial? Okay, very important. Next slide is also important. Very important to know about proximal and distal. What is the difference between proximal and distal? So distal means away from the body. Proximal means close to the body. Okay. So every limb, every organ which is attached to your main body has a proximal side and a distal side. So that is you need to learn. Then you should also know about what do you mean by supine and what do you mean by prone position. Okay. What do you mean by supine and prone position? So this is what is important. This is a small chapter, but understand about all the medical terms, planes, body cavities, etc. So that's all. Short recap of all your lectures. Now, any doubt